Facial pain can be a very troublesome symptom. The reason for this is that it can be particularly very, very severe, and it can affect any part of the face. Now, obviously, the face contains a lot of nerves, and the spontaneity of facial pain and the way that it happens can be triggered off by a multiple number of issues or factors. Sometimes it happens by itself. But obviously it can happen as a result of eating. It can happen because of cold weather. It can happen because of something that you drink. But normally, with regards to facial pain, it can be really spectacular, and it can be extremely painful and quite disabling. The problem with facial pain is that it's quite difficult to treat, and there's no doubt about it that anybody who has suffered from it has suffered quite badly from it. The ways, typical examples of facial pain can include trigeminal neuralgia, but also can include trigeminal neuropathic pain, or even problems with joints, particularly the temporomandibular joint, which is situated just about here. So all these type of conditions can lead to facial pain. Now, the treatment for facial pain there are three main ways in particular, and obviously the first way, which is probably the most non-invasive, that includes things like acupuncture, or particularly sometimes we use brace if that's necessary, particularly when we're dealing with temporomandibular joint disorders, or any form of kind of physical therapy, possibly to help reduce the tension that is causing the pain, particularly around the trigeminal nerve. Secondly, we could try some medications. These particular types of medications, which can include sort of things like antineuropathics, may well help to taper down the type of pain that one experiences. Now, there are a number of antineuropathic medications that we can use, but there are some a little bit more geared towards facial pain. And thirdly, there are these things called injection therapies, or minimally invasive injection therapies, should I say. And these aim to try and address the particular nerves that are involved with the type of pain that you've got. You obviously might have heard the word trigeminal. Well, in actual fact, the trigeminal nerves is part of the cranial nerves, and this is particularly the one in most cases that is affected regarding facial pain. And if we address the trigeminal nerve and try and introduce medication to that nerve, then sometimes we're able to placate the type of symptoms that one has. This type of procedure is obviously very, very, has to be done in a proper environment and needs to be done under the right supervision. We normally perform these in the theatre. And this under some degree of sedation. We normally use some form of imaging technique, which can include ultrasound or possibly fluoroscopy, and sometimes in certain cases we have used CT. These sort of scans or images are able to sort of give us a careful direction towards where we need to put the medication, and in most cases we normally place a little bit of local anesthetic and some steroids to the affected area. The procedure itself doesn't take very long to do, but obviously it needs to be done very carefully. But the potential side effects can include bruising and a slight increase in pain, but also there is a risk of causing infection and also possible nerve damage. If you could imagine that we are addressing the nerve in order to try and treat it, we are at the risk of damaging that nerve even further. So these are not taken too lightly, and carefully a discussion with your practitioner at the London Pain will determine whether or not this type of treatment is for you. But let's be clear, facial pain can be eminently treatable and is something to come and talk to us about should you have it.